I introduce Dr. Govind Tripathi. Govind Tripathi is a very well-known old friend and a very hard-working person with a strong commitment to tobacco control. We all know of his activities. Uh, but formally, if I to introduce Dr. Tripathi, is working as technical advisor tobacco control for NTCP at the Union Southeast Asia office, New Delhi, having around 20 plus years experience in various areas, which include policy-driven initiatives, support to states for planning and designing of training manual, collaboration and convergence amongst various government organizations as well as NGOs for building capacity of officials and establishing the infrastructure, both at center and state level for enabling the systems for result-oriented health initiatives. I invite him to speak on multi-sectoral engagement, including role of civil societies and media. Dr. Govindji.
Yes, yes. Thank you very much, Dr. Rakesh, for introducing me. Good afternoon to chairs and other organizations. And thank you for providing me this opportunity to be the part of this wonderful national conference.
Dr. Tripathi,
yesterday,
please screen
yes.
share presentation.
Please clarify to him again. What do you want to say?
Yes, yes. So this is my presentation. I run from my side. It's okay, fine?
Yeah. I think
Yes, sir. Yes, sir.
It's visible now? It's visible, my screen?
Yes, sir. Govindji is visible.
Okay. Thank you. So, yes. How to go for the next? This is, yes, okay. So as some of the presenters also touched upon this subject yesterday also, I had very good learning from some of the presenters. They were discussing about the importance of multi-sectoral engagement, because if we see NTCP, National Tobacco Control Program, it is an understanding among the service care providers or the administrative officers or various department officials, like this is the domain of the health department, and they have to take the initiative. We are not directly linked with that. So this is somewhere a misconception is there. That is why I think after having the second GATS result, we found that although the significant decrease we have noticed around 6%, but definitely it's not enough. It's just a beginning of change. So we have to understand where are the other opportunities, where are the lacunas, what are the important factors, what are the important initiatives to be taken. So one of that is very important thing, that multi-sectoral engagement is required, where different departments' responsibilities should be very much cleared, but they have to know, we have to keep them in loop, and the integration with their programs, or integration intra-departmental or interdepartmental integration, which is also relating to the same subject, is also required. Then we can achieve our desired goal, desired success, and the change which we need to fight. Yesterday, Dr. Open Bhojani was very rightly said that the tobacco industry interference is very much currently. We have seen that the CSR initiatives, under CSR initiatives, the Company Act, under the Company Act 2013, that is very much clearly written that there should not be any activity which is harmful for the well-being, for the welfare of the society under the head of the CSR. But despite that, the tobacco companies are still getting undue advantage, and they are making their brands image through the CSR and all. So this is one of the example where multi-sectoral engagement is required. Primarily, there are 5 sectors which are responsible, where if I take the example of the central ministry, that is the ministries, various ministries. The civil society is another pillar which has important role, because the civil society is always bridging the gap between the community and the service care providers, the implementers, administrators. And thirdly, the academia, which is always doing wonderful jobs, such as like the PGI Chandigarh and other institutions. They used to provide the data by several surveys and compliance surveys and various other practices. by which we have to we have found another survey like the gets second. Thirdly, fourthly, the doctors and the victims, either they are the oncologist or they are practicing in any sector, but the doctors, if the doctors are sensitized enough, they in clinical practices, yes. So this is the key ministries to engage for NTCP, Ministry of Health and Family Welfare. These are just the snapshots of the Ministry of Agriculture, Ministry of Social Justice and Empowerment, Ministry of Finance, Ministry of Home Affairs, where the mainly role of the police comes up, the Ministry of Labor and Employment, Ministry of Information and Broadcasting, Ministry of Road Transport and Highways, Ministry of Railways, Ministry of Rural Development, Ministry of HRD, where the educational guidelines is the main important role of the Ministry of HRD. Other than that, there are certain other things. Ministry of Panchayati Raj, and the role of academia and institutions is already discussed. Role of other stakeholders in tobacco control is NGO, municipal corporations, CSOs and NGOs are very important because they are bridging gap between the community health providers. State governments can empower CSOs and NGOs under the SLCC. Media interface through NGOs is also one of the important thing, because the role of the media is one of the important pressure group. They can create a pressure group and they can create they can understand the flaws and they can support the system. So this is why I understand that the role of the different departments, whether this is the role of the media, whether this is the NGO, whether this is the Department of Health and Family Welfare, under which we are working and we are supporting, the same system goes down to the state, the same system goes down to the district. We have to understand the larger umbrella of manufacturing and the structure of the larger umbrella, and we have to follow up and we have to sensitize other stakeholders for their roles and responsibility to develop proper planning and to implement this in for desired goals. Thank you very much.
Thank you. Thank you, Dr. Govind ji, for a very nice presentation. It covered the scope of the conference overall. I wish you had more time